Okay, today we will talk about the mediastinal imaging. Mediastinum is basically the part between the two lungs. The cavity between the two lungs is called the mediastinum. The learning objectives are to understand the new classification scheme used to compartmentalize the mediastinal masses, to provide the differential diagnosis of mediastinal lesions, and to review the basic diagnostic evaluation of mediastinal masses with some case examples. For mediastinum, basic mantra is to localize the mass to the mediastinum and to characterize it on the CT or MR imaging strategy. How to say that mass is arising from the mediastinum? First, it has no air bronchogram. As we all know that air bronchogram will be when it will be the mass of or any lesion of the lung will cause the air bronchogram. Whereas in the mediastinal mass or lesion, there will be no air bronchogram. These all are the examples of the mediastinal masses. This is the example of a Pancoast tumor. As you can see, it is forming an acute angle with the lung. It is the mass lesion arising from the lung. Whereas this is an example of a thymoma. I have illustrated it. It is forming an obtuse angle with the lung. Imaging strategy is to characterize on CT on MR whether the mass contains fat, like in these lesions, or a fluid, or they are vascular masses. Again, saying that mediastinal masses has a smooth, sharp margins, obtuse margins, bifurcation point of the trachea. This is the trachea coming on chest X-ray, and it is causing its displacement widening. Basically, it is causing widening of the carina. Now, there are various ways of classification of mediastinal to compartmentalize the mediastinum. Various different methods are used. Anatomists basically use this classification system. They divide first the mediastinum into the superior mediastinum and the inferior mediastinum by line joining from the manubrum and sternal joint, manubral sternal joint to the D4 rib. The area above it is the superior mediastinum. The region below it is the inferior mediastinum. I have written above the thoracic plane. The this is also called the line of Ludwig, and inferior is below this. Anterior mediastinum is bounded anteriorly by the sternum. This is I have outlined the sternum, and posteriorly it is outlined by the anterior margin of the pericardium. This is the cardiac shadow. This is the lateral chest X-ray. We can see that this is the cardiac shadow, and the posterior boundary of interior mediastinum is bounded by the anterior border of pericardium. This is the anterior border of pericardium. This is the posterior border. We can see this is anterior aspect, posterior aspect, as this is the ribs. Okay. Then then we again draw one line at the junction posterior border from the posterior border of pericardium to the uh, second line is costovertebral junction. This is the area between it is called the posterior mediastinum. Rest is called the middle mediastinum. The contents of the middle mediastinum, according to the anatomist classification, it contains the pericardium and its contents as well as major vessels and airways. This is again, I have described that this is the again division from the angular flames, but this is no longer used. Most recent classification which is used is this is applicable. It is also applicable on CT. It is by the International Thymic Malignancy Interest Group. There is nothing like superior mediastinum. They divide the mediastinum into anterior mediastinum, middle or visceral mediastinum, or posterior or paravertebral mediastinum. I will show you. Again, this is again, I am showing you the classic. Again, this is the different boundaries which are used and their contents. Now, anterior mediastinum contains thymus, fat, lymph nodes, and internal mammary vessels. Then middle mediastinum contains heart, as you can see. That they have divided it into the prevascular system, anterior to the pericardium. This area all is the anterior mediastinum in the yellow color. And posteriorly, they draw a line on the vertebral body approximately 1 centimeter from the vertebral body. Okay. The line behind it, it is all the posterior mediastinum, or now it is also called as the paravertebral compartment. The area in between the prevascular, see, this is the sternum. These are the rib ends, but manubrium sternum forms its anterior border, and posterior border is formed by the posterior pericardium, line drawn along the anterior pericardium. This line. Okay, this all star area is the anterior mediastinum. Anterior mediastinum is very important. Very few cases of mediastinal masses we encounter in our daily life, and among them, most are from the anterior mediastinum. Now we will look at the various components of the different mediastinum compartments and their pathologies.